I was diagnosed with a Hodgkin's lymphoma. They detected a mass on my chest and it was growing 1 centimetre a week and I was losing 1 kilogram a week. They told me that without treatment I would have between 3 and 6 months to live.
I was diagnosed with non-Hodgkin's lymphoma. I had been through a relapse treatment nearly 10 years after the first time round. The treatment went well, but then I only got a very short remission. About 6 months I had a couple of lumps come back, so
I had 1 or 2 lymph nodes removed, and that's when I got the diagnosis.
All I distinctly remember from that hour-and-a-half appointment was him telling me it's not curable.
Before diagnosis, I was training for a marathon. After the chemo, it was an adventure to get from the bedroom to the kitchen. I went from being the fittest I've ever been to completely useless.
when I was in bed at night with my husband, I'd be crying and going, I don't know if I can keep doing this. He was a rock through the whole thing. That's when the option of the clinical trial came up. And I thought, oh, wonderful.
I participated in the RAFL trial. My haematologist, from an emotional point of view, she really pushed the importance to keep going, and enough support in there to get me to go on and keep going.
So we met on that first morning at chemo.
We had each other to talk to, how are you going?
What's happening?
Just catching up with each other, because we don't know we never knew each other before the treatment.
No.
Gretchen and all the nursing staff from the hemo unit. It was like a team effort. You'd be talking to them, you'd be stirring the hell out of the nursing staff, and they'd be abusing you with a big smile on their face. Yeah. Everyone looked to try and lighten the atmosphere.
Yeah.
To try and, as I say, to try and avoid the negative side of the reality, I guess.
One of the things I didn't realise at the time is just how good it is to be on a trial. It's what is regarded as the world's best treatment versus what is regarded as the next best treatment.
I went back into the gym from a psychological point of view. It really helps recovery. Just because, you can feel yourself getting stronger. I have a good future without Hodgkin's.
I could pretty well forget about the cancer, except I have to put a hat on every day or a wig or something. So life is really good. I have lots of energy. Ray and I went to New York recently, riding a bike in Central Park. And I'm not much of a bike rider, but I had the energy to do all that in 30-degree heat, so at my age I'm amazed.
Without patients who are willing to participate in clinical trials, we can't step forward in finding the next treatment to advance medicine. Without trials, we wouldn't be able to trust and put trust in new treatments, and that's why they're essential.
Being a well-resourced clinical trials unit allows us independence. This allows us to choose investigator-initiated trials, trials where we as clinicians feel that there will be benefit to patient care and outcome.
It allows patients to get access to new drugs, often years before they'll become available on the PBS. And for some of those patients, those drugs can be life-saving.
My appreciation of the medical facilities that we have in this country is just sky high.
This is the only way that we're going to get it better for the generation after us and the generation after that.
I'm almost to the position where I don't regret having the cancer, which I never thought I could ever get to that situation.